Hello. So last week we went over this case and how doing clear aligner treatment without attachments, interproximal reduction, or rubber bands would lead to this result. And I wanted to show you something else about this case that is very noteworthy and could change the way that we treat this case altogether. And that thing is only evident when we look at the x-rays for this patient. And the first thing that drew my eye right away was just how short the roots are. If you look at the roots of those lower incisors, for example, this root right here, this root right here, it's pretty short. And I mentioned that to her, and the first thing she said was, yeah, I went through braces before, and they told me that my roots got shorter because of my first round of braces. In fact, that, according to her, is the reason why she lost this tooth right here that used to be here. She said the root got so short that the tooth was not viable anymore. It became so loose that she had to lose it. And so that significantly affects the way we treat this case. It affects the amount of force that we can place. It affects the mechanics that we can use. And most importantly, we need to tell the patient that there's a risk if we try to move her teeth again, that this resorption, we call this root resorption, that this resorption could continue. This is how long the roots should look. And this is how long her roots look like right now. So if we put braces on this patient's teeth and the root resorption starts all over again, the roots could get so short that she might lose several teeth if we're not very careful. The contract that clear aligner companies use will make you testify that you've been to your general dentist and that your dentist has cleared you from a list of conditions including root resorption and gum disease. But this is actually unheard of in healthcare. If I need a surgery, for example, and my surgeon sends me over to my internist to have my internist clear me for the surgery, there's no way that my surgeon would rely on my own word if I come back to him and say that my internist has cleared me. My surgeon would have to have a letter written and signed by my internist and delivered directly from my internist to my surgeon saying that I've been cleared. And if I, as an orthodontist, send a patient back to their dentist to get clearance that their gums are healthy enough for orthodontic treatment, and I rely on the patient's word that they've been to the dentist and they've been cleared instead of a letter directly from the dentist, that would certainly not absolve me from liability and would not shield me from legal action if the patient loses a tooth because of having braces with uncontrolled gum disease. But this is not the only thing that I wanted to draw your attention to in regards to this case. Another very important finding is this. This is a cross-section showing one of the front lower teeth for this patient. Notice the root shortening that I talked about. The length of the root is almost the same as the length of the crown, and if you measure the root from actual bone level instead of from tooth neck level, the crown root ratio would probably be more than 1:1, which is not really a good thing for any tooth. But look at how thin the bone is. Look at how skinny it gets right here and how little bone she's got on the inside of this tooth, for example, and how little bone she even has on the outside. And if the plan is to simply tip all the teeth out, like we said, at home clear aligner companies, because they don't use attachments or rubber bands, all they can do is splay out or crunch in. So if you imagine this tooth being splayed out, meaning it's going to rotate around a point that's probably somewhere around right here, this part of the tooth is going to tip out and the bottom part of the tooth is going to tip in. And when that happens, the bottom part of the tooth is going to be completely outside of the bony casing because that part of her jaw has such thin bone. And what can happen to a tooth when the root is completely outside the bone is kind of up in the air. Some teeth would lose vitality, meaning the tooth would die and need a root canal. Sometimes, if the root tip tries to come out of the border of the bone, then root resorption, which we discussed, can become more severe. So this patient's root could become even shorter just because of the root tip trying to get out of the confines of the bone. Sometimes inflammation can happen because when the root tip is outside of the bone and it's bulging through the gum, that could cause the gums to get pretty inflamed in that area, which could lead to its own set of bad consequences. Or worst case scenario, the tooth may just be lost. It may become so loose that it's not savable anymore. This is a different bottom front tooth. Notice how the outside bone is so thin, and if this tooth gets tipped out, it's very likely that it's going to step out of the confines of the bone, and you will end up with something called a dehiscence. A dehiscence is when there's no bone on one side of the tooth, and the gums, because they're supported by the bone, when there's no bone, the gums follow. So when the bone goes away, the gums shrink back, and you'll get these lesions called dehiscences showing parts of the root. Sometimes it's a major part of the root. Not only is that just unsightly, but it also means that the tooth has lost that much support, and it wouldn't take much trauma for that tooth to come out or be avulsed, like we say. But here's the really important issue. This side view that you're seeing right now can only be seen using either a cone beam CT machine or a lateral cephalogram, and both of these X-ray machine types are not available at general dental offices. So even if this patient did get clearance from her dentist to undergo orthodontic treatment, her dentist would not have been aware of the thinness of the bone around the front teeth because they would have no way of finding out without taking this type of X-ray. And so these are two reasons why even a seasoned orthodontist will have to approach a case like this with lots of care. And I know many orthodontists who would probably not even approach this case at all. They would just tell the patient that it's too dangerous to put braces on her. So in the future, I'm going to show you more and more cases showing what at-home clear aligners can and cannot do, and what can be some of the consequences of pursuing at-home clear aligner treatment or direct-to-consumer clear aligners. Until then, later.